Hi there, I'm Dr. Rebecca Staple. It's so nice to be here. Thank you for inviting me when Dr. Tarantino reached out to me to share some exercises with you guys. I was really excited. I obviously go over a lot of information with pet parents one on one during appointments, but I always really love the opportunity to speak with a group of you. I also just wanted to start off by giving you guys major props for doing the course. It just truly shows that you're so proactive with the care of your senior pets. You must love them a whole lot. They're so lucky to have you. So thank you for having me. Again, I'm Dr. Rebecca Staple. I'm a rehab vet, also certified in acupuncture, and I'm really excited to go over some practical things that we can do for our senior pets at home. So, to start with, just a little bit about me. I did go to vet school at Western University of Health Sciences. That's in Pomona, California. I am California born and raised, so all of my education mostly has been in here. After my veterinary school, I did do a rotating small animal internship at a specialty hospital in Los Angeles. It was primarily emergency based, but I also worked with all the specialty teams like surgery, oncology, cardiology, internal medicine. I got a lot of great experience there. And what was interesting is when I was working at the specialty hospital, our main goal, especially in emergency critical care, is to get the emergency under control, save these pets, get them home. But we didn't get to do follow up. And so a lot of the care that was given was more urgent care based, and it didn't have a big focus on quality of life for that pet afterwards. I did find a couple of rehab centers when I was there in LA, and so I got to shadow and spend some time there, and that's really where I learned that this was an avenue I wanted to pursue because the focus was more on the quality of life of the patients, getting more quality time with pet parents, helping dogs be able to walk again and walk better, and just improving their ability to do the things that they love to do. So I did move to the central coast of California where I'm located now in San Luis Obispo. I was working general practice, some shelter medicine, and during that time I did end up getting acupuncture certified through the Chu University, which is based out of Florida, and it is very heavily focused on traditional Chinese medicine. So it was a really good perspective that I hadn't had before, and I really loved the program. It was really wonderful. During the same time, I also did coursework in canine rehab training. And so I was going on campus with other veterinarians and actually other human physical therapists to do rehab training. And that was very intense. We did testing and case reports, and I did rotations. I did those for both that and the acupuncture. So it is, those were two big certifications that took me over a year to do them, and I did them both at the same time. So it was a lot, but I had those new tools and I took them back to practice, and I decided to open up my own practice because we have no rehab facilities locally. So in 2018, I opened Coastal Veterinary Rehabilitation and Acupuncture. It is a mouthful, but I was the first, and I'm still the only referral practice that sees patients for these therapies. So I work on a referral basis. I just am treating the rehab acupuncture components. This is not a full-scale hospital, but this is what I do every day is see patients for pain management and mobility. My continuing education has not ended. I'm constantly getting new certifications and new trainings. I've done a food therapy course, which is like Chinese medicine, use of foods in therapy. I've also done more traditional nutrition therapy, as I think nutrition is such an important topic, but with a more Western-based approach to like balanced nutrition. I've also worked at some courses through North Carolina State on myofascial seminars where I learned about trigger points and the whole network of myofascia in the body. So yeah, I think it's never ending, the learning. There's always new things to learn. And I'm so grateful to be able to bring the knowledge that I have to help treat my patients. I did also want to introduce Banjo. So he's my heart dog. He may not look too senior, but he did just turn 10, which was a hard pill for me to swallow. But he is my coworker. He comes to work with me every day. He is a rescue. We thought we got like a mixed herding breed dog, but his DNA actually came back 100% border collie. So he's a short hair, smooth coat tricolor. He is incredibly smart, and he has helped me really learn how to teach dogs how to do these rehab exercises because it's so much training involved. Except he's so smart, he's not always very helpful because he just is very intuitive and knows what I'm thinking. um, but you will see him a lot in these pictures. He's a great model. It's helpful to kind of see on his body where things are located, which can be more difficult with different breeds and different weights. So he's just a good model. So you'll see a lot of him in this presentation. So a brief little overview about what we're going to talk about today. We're going to briefly talk about rehab and what that is. We're going to talk about the top 5 exercises I would recommend for senior dogs. There are so many that you could do, and a lot of it can be patient dependent and can change based on the individual. I am not a cookie cutter veterinarian, so everything is adapted just for the patient. But these exercises I have here are very safe to do kind of no matter where you are on the scale of things. I'm going to briefly just chat about traditional Chinese veterinary medicine because that's the basis of acupuncture and acupressure. And then we can go over some acupressure points to help with our senior patients. So, what is veterinary rehabilitation? The main thing is we want to identify and control pain because that's what causes so much of an issue with function. When we talk about returning to function, a lot of the time I'm asking owners what their pets can do and what they can't do. So, how are they maneuvering stairs? Can they stand up? Can they lay down? Can they jump in and out of the car? Do they have beds on the couch? Can they get up and down? So, just kind of what functions they can do, and then it can even come down to can they transition from lying on their tummies to their sides, that kind of thing. So, veterinary rehabilitationists do become experts in physiology, structure, and the structure is so different between all the different breeds and sizes. And so, it's not like humans where they kind of all look the same. There's a lot of structural differences between all of the patients. They all have different medical needs, and that can change what we can do with them from a rehab standpoint. Different ages, they may have other health conditions that we have to keep in mind and be knowledgeable about, and exercise levels. Everyone comes from different levels. So, I mean, I have agility patient athletes, and then I have some patients where they're, weekends, family dogs, they're out hiking and running at the beach, but during the week, they're not doing much. And then I have patients who can't walk at all. And so it's really just figuring out the right programs to be practical for each of these families. We do use physiotherapy modalities. So, one thing I do want to emphasize is a lot of people will send dogs for PT, saying physical therapy. Physical therapy is actually a protected term, and its use is to only be used to when referring to physical therapists who have gone through their own extensive training. They're really wonderful. And some physical therapists do treat dogs and cats if they have additional training. But physical therapy is a protected term for them to use, just like they cannot say that they are doing any veterinary rehab because veterinary is a protected term. So, and it does change a little bit by state on how strict they are about certain terminologies. But there are some states where human trained physical therapists can have their own mobile practice and treat on patients at homes. Whereas here in California, it's a little bit more strict with our laws. And so physical therapists can only treat dogs and cats if they're under direct supervision of a veterinarian. So it just changes about where you are. So I just encourage pet parents to always know the laws where they are to make sure whoever they're seeking either PT or rehab from is following the right laws. So when we talk about different therapies with rehab, there's a few different categories. First is manual therapy, and that's things like us doing passive range of motion on the patient, doing joint mobilizations, releasing trigger points or knots, and a lot of therapeutic massage. Therapeutic exercises are what we're really going to be talking most about today, and that's the fun part, where we get to focus on strength, balance, and coordination, address specific sports or injuries, and then come up with a home exercise program. There are also therapeutic modalities, like that's what you think of when you talk about laser therapy, using ice to ice sore joints, electrical stimulation you may have seen or you may have had yourself at some point with the little pads to send electrical signals to muscle groups. There's also pulsed electromagnetic field therapy or PMF, which is like the Assisi loops that you might find. And those can be a good modality to help with certain conditions. I also work a lot with assistive devices, whether that's booties, braces, orthotics, and of course, wheels or carts. So, when we talk about senior dogs, there could be a wide range of mobility concerns. Certainly, one of the first things we see, if a dog does not have a history of prior injury, is that as they get older, they start to develop some muscle loss, which will then lead to weakness. So, that's one thing that we want to address. But basically, we have these senior pets who, over the years, may suffer from arthritis or other degenerative diseases such as intervertebral disc disease, degenerative joint disease. And so, obviously, as they age, that means the longer the time they've had that condition, so it's progressed. A lot of these patients do have poor core strength, and that just comes along with some of the weakness. And again, if they're not maintaining that core strength throughout their whole life, it's just one of those things that gradually gets weaker and weaker. A lot of senior pets do end up with vestibular disease. So I don't know if any of you have that, have been managing that. But loss of balance and body awareness, a lot of uncoordination. So trying to address that with exercise can be really helpful. Over the years, they also can get reduced flexibility, whether it's in their spine, they can't really turn side to side as much, or their neck, and also their joints. I have measurements of what a normal joint should be. So when I see my patients, I take measurements to see what their range is of that joint. So over time, especially if they had an injury when they were younger, they can start to lose that range. And of course, as they get older and they get weaker and more unstable, they can develop new strains and sprains if they were to fall or slip. There are cancer-related mobility concerns, certainly with conditions like osteosarcoma, which is cancer of the bone. So that can be painful and also lead to mobility issues. That can also lead to amputation in some instances, where we can also do rehab and exercises to help the body build core strength and balance after an amputation has been performed. A lot of senior pets have other diseases going on. You might have thyroid disease, which changes the whole metabolism in the body, and that can really affect their exercise tolerance. Kidney disease, heart conditions, all those things can affect a patient's mobility. And then the main thing I want to emphasize is compensations. So a lot of people, think of, oh, my dog tore his cruciate ligament when he was young and he's got arthritis there. So, and some vet practices focus on this too. They're like, let's focus on this knee, let's do laser, let's target this knee. But that dog, over the years, their lower back is going to be compensating for that knee, which means their shoulder muscles and neck are going to be compensating because they're carrying even more weight forward. So a lot of what I'm seeing with these senior pets that come in is they've just been compensating in other areas, not just the injured area, but that means the other side is going to be doing more work. So they're going to be really tight, have knots. We want to stretch them out and address those other areas too. So this picture is of the sweet girl Kaya. She had really bad hip arthritis and knee arthritis and elbow arthritis, but you can see the way she's standing, her weight is really shifted forward onto her front legs. Her back is not a nice straight line, and her core is pretty weak. So there's a lot of areas where she was painful and a lot of areas where she was compensating. So we needed to address all of those areas. So when we develop an exercise plan for patients, we do want to focus on pain control. That's my number one, because if the patient's too painful to get up and move around, then we can't do much with exercises. So we need to get the pain under control. And I am somebody who believes in combining both worlds of medicines. So yes, let's reach for the prescription medications when we need it. Other times we can focus more on supplements and herbs and other things, but whatever we need to do to bring that pain level down so that we can get the patient up and moving again to rebuild the muscle. We also want to restore the range of motion and flexibility of joints. Definitely work on strengthening. Core strength is goes right along with balance. So in these older patients who are starting to lose balance, might be weak in the back legs, we really want to strengthen that core, improve body awareness or proprioception. There are wonderful exercises we can do to work on that. And then another main thing that's so important to me when we're working on exercise is just the mental stimulation. Dogs love it because we're pretty much doing training and they're working for treats. And so this is a fun thing for them. It should be a fun thing. So it's just like teaching an old dog a new trick, and it's really important for them to keep learning and stay stimulated in this process. And the main thing I always tell owners is to keep it positive. So if we're asking a dog to sit and stand up and sit and stand up, for example, but it hurts because they have arthritis, we need to be using treats. I don't know if any of you have ever gone to physical therapy. Sometimes some of the things they make you do are not the most comfortable, but you have someone there who's a very positive trainer type person that gets you through it. Um, so you have to act as that person when you're doing exercises with your dog too. So using treats, I know a lot of seniors with other conditions might be on limited diets, or we might be trying to do some weight loss programs, in which case you can definitely use the food that they get for meals and just use the calories from the meal times for the treats and exercises. So you're not adding in extra calories or adding in different things that might upset, their IBD or whatnot. So just find something that they do like and enjoy so that it's a fun experience. It's a really good bonding experience too. So I hope that that's a helpful tip because sometimes I see pet parents come back in, they're like, oh, they won't do the exercises. And then when I'm asking, they're not even using any treats. So the dog doesn't really have a good motivation to do it. So here are the top 5 exercises for senior dogs, according to me at this moment. This is not all inclusive. There are other things you could do. We're going to go through each one individually and talk about them. But I hope this is a helpful list for you guys to get started. So number 1 is the cavalettis. Ideally, you want 8 cones with 4 poles. So basically, it's a cone on either side and a pole between them. There's usually like a hole in the cone, so the pole just slips through that. I've had owners get creative and they use brooms and rakes in the hallway, so it doesn't have to be a fancy equipment either. I usually space them about body length apart, so from like the hip to the shoulder. That's how the distance you want between each of the poles. But if in general, like further apart is okay to start when they're just learning this. When it gets narrower and narrower together, that actually makes it harder. So if you're just starting out, it's fine to just have them really far apart. That's fine. I start them at 2 inches high off the ground, the pole. So you could just get 2x4s and some PVC pipes and lay those out, or stack of books with the pole between them. I've had one owner get like jugs of water and drill holes in them, so it doesn't have to be fancy. The main thing is you want to walk the patient very slowly over the poles. This is not an agility cavaletti program. So we are not trying to race through this really quickly. We're just very slowly trying to train the pet to walk up and pick up their feet. So this is an amazing exercise for body awareness, for proprioception, especially for dogs that are starting to drag their back legs. I use this a lot for dogs with spinal injuries that are just don't have strength or body awareness in their back legs. Um, and it also helps them because they do have to step up, so they have to flex their ankles and knees and hips in order to pick up and over. So this is also a great exercise for those who might have had a chronic knee injury or have hip issues and have lost some of that range of motion. The higher we end up lifting the pole up, the more they'll have to flex to pick up over it. So I always just start at 2 inches high to get started. Again, this is a really great one. It's one of my favorite just all around exercises because it's good for anybody. I have okay, so I do have a video here of a dog walking over the cavalettis. Canva is not letting me play the video while I'm in this recording mode, unfortunately, so maybe I can troubleshoot that with Dr. Tarantino to get you guys some videos. But basically, this is a sweet little 18-year-old named Charlie, and he's walking over the cavalettis, and I just wanted to have that on there so you could see just how slowly I'm encouraging him. Right now, he's not on a leash or anything, but for him, he's happy to just follow me if I hold a treat in front of him. There are some dogs that I do have on a leash, and I walk with them very slowly over it, and that way I can control um, their gait, because some dogs get too excited and they're trying to run over them. And again, we don't want that. We want them very focused on where each foot is in place. So if you think about our body awareness and proprioception, it's how we know how to walk without looking at our feet. And so dogs have 4 feet that they're not looking at. But so this is helping them learn, like, there's a pole coming and I don't want to knock it and hit it. So when dogs are learning, you might hear them knock at those poles as they're going over. Um, but as they get better, hopefully you'll hear it and you won't hear that knocking sound. Okay, and then we've got knuckling. So this is a really great exercise. Again, this was supposed to be a video, so I'll work on that. But basically what you're doing is you're lifting up, and you can do this with any leg. But I'm usually focused on the back leg since that's the common area for dogs to start to lose some of their sensation. But you support the body. So I have one hand on Charlie under the tummy so that he can't fall over. And I lift up the back leg, and I'm essentially putting his paw like this. So it's on top of his toes. And so he should feel that and correct it. And so again, you do this a few times in a row. I usually do 5 repetitions on each foot and then go to the next foot. If you have a patient who is just standing there and acting like they don't realize that their foot is flipped over, one of the first things you should do is make sure they're actually bearing weight on it and that they didn't just shift their weight onto the other side. So you just want to nudge them to make sure that there's weight. Sometimes that's enough for them to be like, oh, and then correct their foot. If, however, they're standing there and the weight is on there and they're not moving it, what I like to do is I take my finger and I just kind of stimulate between the toe pads and I push gently. That'll get them to flip it over. So anything you can do to stimulate them to pick it up on their own is the best way to do it. Otherwise, you can kind of pick it up and do it for them. But I always am under the impression if the more they do themselves, the better. So this is a great one. You can do it in the front legs as well. Just make sure, again, that you're supporting them so that they won't fall over. But this is a fantastic exercise, again, for dogs who might be dragging their back legs, losing feeling and body awareness. Again, it's a great one, not just because it's an exercise to retrain that reflex, but it's also a good gauge to you on how your pet is doing. Because if you start this off and you're like, oh, they're doing great, and every day you do some repetitions of that, and then a couple of months from now, you're seeing that they're getting a little slower with it, or if they're just standing on their feet and not flipping it, that's a sign to you that things might be progressing and to get it checked out. Backward walking, again, I had a video with Banjo doing this, so we'll work on it. Backward walking can be a tricky one for pets to learn, but it is one of the best exercises that they can learn to do. So every pet learns this differently. So when I'm teaching them in the rehab center, I kind of have to get creative. Some pets you can just walk. So with Banjo, I'm just walking towards him with a treat. And then when we get to where we're done walking, he gets the treat. So he comes towards me and then we walk back together, gets the treat. Some dogs are fine with that. Other dogs need a narrow space. So I recommend like the coffee table and the couch, or the couch and the wall, or just a narrow space that's as wide as your dog. Have a treat and guide them to go backwards and give them the treat. And then they'll walk forward and then guide them backward again. Backwards walking is one of the best exercises for actually the hips, because it's so good to strengthen all of those supporting muscle groups in the hind legs. So backward walking also great obviously for body awareness, because that's not really a direction that they're moving very often. I also do sideways walking with patients too, which would be wonderful, but backwards walking, if you can get them to do it, is wonderful. You can start with just a couple steps, and for some patients that might be hard enough to just get a couple steps backwards because they might start to lose balance. Um, but if you can gradually get them to progress to going across the room, that is wonderful. Leg lifts is another exercise. So, again, you want to support the body. You start with a three-legged stand. So, you're just lifting one leg at a time. You lift the foot just slightly off the ground until you feel the weight shift onto the other side. The biggest mistake I see pet parents make with this one is they think they need to just lift up the whole joint, the whole leg. And so they're flexing everything. And then some patients are sore in their knees or the hips. And so that's uncomfortable for them. And then the pet parent thinks that this exercise, they just won't do it. But we just want to do it in a way where I'm not trying to, this is a little girl named Daisy. I'm not trying to flex all of her joints. I am just very gradually lifting up that leg. So it's, the toes are just off the ground until I felt her weight move off that leg and more onto the other leg. And again, I'm supporting her body so nobody's falling over. Um, if this, and then you can do this with any leg. So basically, what we're doing is an isometric exercise where we're shifting weight onto the other leg to help strengthen that leg. So we're able to strengthen legs without having to do like a lot of sit to stands and bending a lot of joints and hurting muscle groups. So it's a static exercise where the patient doesn't have to move, and it helps them strengthen this way. If this becomes too easy for patients, the next step is to move to a diagonal leg lift where you lift one back leg and then the opposite front leg. So they're, standing. It's like when us, if we are doing, the alternate extended raises when we're doing yoga. So it's the same thing for them. This is excellent for core strength as well, not just strengthening the legs that are on the ground. If patients cannot tolerate lifting the leg at all, so this is little Charlie again. Here I'm trying to demonstrate weight shifting. So rather than lifting a leg, he would just fall over. He's a vestibular disease dog and his balance is not great. So instead of lifting that leg, I'm just holding his pelvis area, making sure he's standing square and shifting his little body side to side. That's kind of the next easiest way to do this rather than lifting the whole leg. That way he's having an opportunity to strengthen his core because he's trying to keep in balance. It's also helping to put a little bit more weight on the left legs, then the right legs, then the left legs. So it's a very gentle way to work on this strengthening. The step stretch is also a favorite of mine. This is a great strengthening exercise for the back legs. So ideally, the step you want to use would be elbow height. So here's Banjo demonstrating on a step we made at home with a yoga mat on it so it's not slippery, and below his feet so it's not slippery. You always want to have things down on the floor when they're working. But basically, you want them to step up with their front legs and then shift their weight back onto their back legs to help strengthen them. One of the common misconceptions I see people make is, oh, we want to strengthen the back legs, so let's get their back legs up on a step or an uninflatable thing, and that's the opposite. So we want to strengthen the back legs by adding more weight onto them. So we're elevating the front legs. One of the most common mistakes I see pet parents make is they hold the treat like right in front of the patient, so they're leaning forward. I want you to notice how I'm holding the treat above Banjo's face so that he's looking up, and that's shifting the weight back down his back. So that's shifting the weight backwards. If we hold the treat right in front of their face, they're just going to lean forward, put all their weight on the front legs leaning forward. They're already pretty much doing that when they're walking around. So again, we hold the treat up and above to shift the weight backward. If this starts to become too easy, you would start to use an unstable surface. So like a Bosu ball or what they call it, a donut. It's like a little inflatable exercise equipment. And that just provides a little bit of instability. So the core muscles are working harder. Their hind leg muscles, you can see them bulge out more. They're working harder. So that's kind of a way to level it up. You can see here on the left, the low foam block is easier. So if it's too hard to go up a full step, just go use something small. So this is like a 1-inch high low foam block for this older Cocker Spaniel who couldn't quite tolerate going to a full elbow height step. And so this is just getting him used to working this exercise. You can use like a book, like it doesn't have to be fancy again. And then on the middle picture is a little balance disc. It has a textured surface, and so that can be an unstable surface. Again, a lot of owners would think that this is working the front legs, but it's actually working the back legs and the core and the back and all those things. And then obviously here with Banjo on the right, when he was younger, this is a big inflatable peanut. So he's really doing a big stretch there with his weight shifted and stretching out his back too. So again, it all depends on where your own pet is at. You can start really basic, just having them put their little front feet up onto a low surface and having them try to shift weight backwards a little bit. So those were the 5 exercises. If you guys have any specific questions about them, please let me know. I can try to get the videos to you because I do feel like that is helpful. But if you need any more tips or have questions about them, please let me know. An important thing I'm always trying to do as part of rehab is to monitor progress. And so in the rehab center, I am taking measurements. I have measuring tapes. I have a goniometer, which measures the angle of the joints. You may not have those tools at home, and that's okay. I recommend owners at least take some video. So, every month, take a video of your dog walking so you can kind of see the change. It's nice to have these measurements to see like the thighs, if they're getting smaller or if we're building muscle and they're getting bigger. But at least a video can be really helpful in just seeing how they transition from sitting to standing and how they're walking. It's also really helpful to look in slow motion, especially if some patients are limping and you can't tell what leg it is. Slow motion is like the best thing. I use it all the time because sometimes it's hard to tell. I have patients limping in multiple legs and they're like trotting, and so you slow things down and it can really be helpful. So I hope you can have some kind of instrument to help monitor the progress. Now we're going to switch gears a little bit and talk about acupressure points. So before we get into that, I did want to provide a little bit of background. With traditional Chinese veterinary that's a tongue twister, veterinary medicine, Chinese medicine has been around for thousands of years. They really discovered how certain patterns and areas of the body were affected and how they all work together. And so it's really incredible because now we have scientific studies that we can use to discover what they discovered a long time ago without CTs and MRIs and X-rays and blood work. So it's very, very interesting, and it's a very cool way of thinking about things. So in TCVM, there are 5 branches. So there's acupuncture, which we're going to talk about. There's herbal therapy. So herbs are a big thing in Chinese medicine. It's usually formulas, and they can be many different formulas for many different things. For example, I have some pain formulas here, and I have about 4 different ones because it depends on the type of pain the patient has. That's all based on patterns. So it's a bit complicated. It's not like in the Western world where we have your pet's in pain, here's an anti-inflammatory like carprofen. In this approach, it's very specific to the patient. There's also food therapy. So I am trained in food therapy, which is such a fun way to think about food. So the idea behind it is that different foods have different um, like temperatures. And so it's kind of like when you think about summertime and why drinking that cool lemonade or cool cucumber water feels so good. And whereas in the winter, when it's cold outside, you want these like warm soups and, with spices and cinnamons and spice cider, that kind of thing. So there's every food kind of has a different energy assigned to it. And so you can give different things depending on what you're seeing with the patient. So I like combining this with the traditional, like Western approach of making sure we have balanced food because that's super important too. But I think it's really fun to incorporate the food therapy component. Tweena is a TCVM based massage work where they use the channels and meridians that we'll talk about in a little bit. But they use that with certain like pulling and pushing techniques. And then Qigong is actually considered part of the medicine, and that's Qigong is meant for the practitioner to do movement and breathing to build their own energy, and for patients as well if they're human patients. But when I did my acupuncture training, they did lead us in a few Qigong classes, which was super fun. I did want to mention this here, especially because it just comes along with, as a caretaker, you need to take care of yourself in order to take care of your pets. And so you need to make sure that you have your needs met, your energy is in a good place. If you're stressed out and anxious, that's not the time to do some acupressure points on your dog. Same thing, like if you're out for a walk together and you get stressed and anxious, they will pick that up from the leash and get stressed and anxious too. So I really just encourage you to think about this. Sure, you could do Qigong classes if you want, but you can also just think about this as taking time for yourself to calm yourself, get your needs met in order to then be the best support you can for your pet. I know caregiving for seniors is tough. I've been there too, and so just like they say, you can't take care of anyone if you don't take care of yourself. So protect your own energy so that we can help our patients and your pets. So 5-element theory is the core of Chinese medicine. So when we think about the 5 elements, people know it's wood, fire, earth, metal, and water. And so in Chinese medicine, each of those elements is also assigned an organ system in the body. So for example, the wood element is assigned the liver. And so in Chinese medicine, they've discovered there's all these meridians or channels throughout the body where they believe that the qi, which is the body's energy, is flowing. And so at different times of day, energy is flowing through certain channels, but everything has to be in balance all of the time, because if like the fire element, which is the heart channel, becomes diseased, that's obviously going to throw balance off of everywhere else. So it's really everything's in a balance and constantly working together. And just like the elements that we think of, like wood will light on fire, and then fire is important for the earth and growing crops. Metal is used to get the crops for the farmers. And then, of course, water we need for all these things too, to grow new wood, the trees, etc. This whole system also goes around ages. So in Chinese medicine, when you're a baby and you're a newborn, you start off as wood. And so you're real fresh, and then you kind of go through a teenager fire phase. As you get a little bit older, you mellow out a little and you're in your earth phase. And you're middle-aged, it's more metal and going by the rules, your routine. And then the water phase, which is what a lot of our senior pets are in, is when they really start to slow down and just rely a little bit more on the rest and recovery, not as social and engaging, just taking more time to themselves. So I do like to explain that to pet owners because it does show, especially in patients that develop kidney disease as they get older, especially if you've had cats, but in dogs too. When they reach the kidney phase, that really shows that they've lived their whole full life. So I just really think that's a really nice way to think about it. It's also really cool to assign different breeds, the typical personalities. So, like a protective Rottweiler would be a wood personality. They're kind of protective. Fire personalities, I think of like little chihuahuas who are very excited, want to be center of attention, will bark. Earth patients, I think of like Labradors, Golden Retrievers, just overall very sweet, easygoing. Metal patients they like to go by the rules. They can be kind of aloof, do their own thing, but they're very nice, but they just kind of go by the rules. And then water patients can be more fearful, reluctant, scared of situations more easily. So it's kind of fun to see what breed or what your dog might fit into as far as categories go. But along with this, when we do talk about acupressure points, since we're talking about senior pets, we're talking about the water element, a lot of the points are going to be on the bladder channel, which is controls a lot of kidney and bladder and water points. And that makes sense given that the kidneys and bladder are in charge of the whole processing of water in our system. Okay, so when we talk about acupuncture points, the Chinese medicine doctors found these pathways throughout the body. And somehow they discovered that this little point and this point and this point all did different things. Um, it's really quite amazing. And now we're able to study those points. So they have taken biopsies of acupuncture points and they've studied it compared to biopsies of tissue next door. And they found acupuncture points do have a higher density of nerve endings. There are more mast cells, which are part of the immune system. There's more blood flow, lymphatics. They're located in motor points, which are really special points in muscle. And then they did find that stimulating these points releases endorphins, serotonin, and other feel-good chemicals in the body. So here are a couple patients getting acupuncture. They are both hooked up to an electroacupuncture unit. So those are the little wires you see. But you don't have to do that. I have many patients, we just do the needles. It can be very relaxing. When we talk about acupressure, which is what you would be doing at home, is we're doing that specifically to these acupuncture points, but we're just using our finger. And so we're not poking anything into the body. So if you go back to see the previous picture with the needle, we're not going to be reaching down into quite all those layers with the finger, so it's not going to be quite as effective as with the needles in the clinic. But this is a really great way to do calming stimulation at home. So with acupressure, you're finding these little acupuncture points that are depressions between muscle groups and tendons, ligaments. Training for finding all of these is very involved, a lot of anatomy. So we're obviously not going to be able to get into all of that right now. I'm not going to be able to train you like full anatomy, finding all the points, but we'll go through a few things. But if you essentially kind of would run the finger down the patient's body where you're trying to treat, and we'll go over certain areas. And then you'll find it's hard to explain, a little area of resistance or a little indent. And then, so I usually rub with my finger kind of flat. And once I find it, then I go more upright and push in. What this picture is showing is that you don't want to bend and like push your nail in there. You don't want it to be ouchy like that. You're just using the pad of your finger. So you just apply really light pressure at first and then keep going a little bit harder and deeper. If the patient is uncomfortable, pull back. You need to like see what your dog is doing. and obviously listen to your pet. So do this when you guys are relaxed at the end of the day watching TV. You don't want to do this first thing in the morning when they want is their breakfast. And also just kind of keep an eye on areas where they like doing this, and maybe areas that are too sore, they may not tolerate it. Okay, so we're gonna go over some important acupressure points. You may have noticed a wardrobe change with my image. I had some technical difficulties with the video, so I'm re-recording these to hopefully this works. Um, there is a lot of anatomy that goes into finding the acupressure points, so I don't want it to be stressful. Obviously, it's beyond the scope of a quick presentation to go over the intricate anatomy involved with finding everything. But these are two really important ones. So if all you take away from this acupressure session is these 2 points, you're ahead of the game. So one that I really like is called stomach 36. This is my favorite acupuncture point of all time. I use it for almost every patient because it's so has so many effects on the body. It's really great for immune support. So, obviously, our senior pets, a lot of them have other conditions going on. Some have cancer, and we really are trying to boost and support their immune system so that they don't get sick. So, stomach 36 is great. It also helps with digestion, whether it's diarrhea or constipation or vomiting or appetite changes. It does address muscle loss, so that's a really good thing that our senior pets need to deal with. And overall, it's like an energy boosting point. It's associated with longevity and the body's chi or energy. So, really great for patients that are weak or tired. When I was doing my acupuncture training, they were also like, learn this point on yourself because most of us are also tired, have low energy, especially certain times of day. So, this is a really great one. To find it, you do find the bend in the knee, so where the kneecap is, and then you go down. Um, Usually, it depends on the size of the dog, but for Banjo, it's about 3 fingers down below that crease of the knee in the front. It's on the outside of the shin muscle that you can feel out there. This can be a very sensitive point, so I do recommend starting with very light pressure before you start pushing a little bit deeper, but this is a great one. The next one that I would recommend being familiar with is bladder 23. There's a bladder channel that runs on either side of the spine. So if the spine's in the middle, it runs on both sides because there's channels that are mirror images of each other on either side of the body. And the bladder channel is really important because each vertebrae has the bladder acupuncture points next to the vertebrae. So that's how you count them down. And each one is associated with different organ systems in the body. So you can pretty much target any place in the body from just the back. But bladder 23, the focus of this one specifically is on the kidney channel. And so, as we talked about earlier, the kidney and it is very important to the overall health of senior patients due to their life stage. The kidney is also in charge of the bones in the body in Chinese medicine. So, again, bone is important for these senior patients. It also helps support the core and helps with back pain. So, it's a really great one to do many things. To find bladder 23, it is located between the second and third lumbar spine. I don't expect you guys to be able to find those and count them for every patient. So, one of the easy ways to do that with this point is you find the very last rib of your dog, and then move your hands up and then towards the spine. And you should feel a little indent right there before you get to the spine, but it's right on the line of the last rib. So that's an easy way to find it. Here we're going to talk about a little bit of pain management general points. The main ones I have circled with the red circle. Those are called the 4 gates. So they're located on the feet. Some dogs are a little bit sensitive with feet. So some dogs may not tolerate this one, but if you can get them, they're very powerful pain points. They're located on the front feet is the large intestine 4, and it's located in between kind of um, the second and third metacarpals, so between the first toes or digits. If your dog has a dew claw up there, that is considered the number 1 digit. So the first long one is actually digit 2. So you would go up between the toes to right up here. So that's a really good one. That's large intestine 4. Liver 3 is the same point but in the back foot. So again, you'd go up. Most dogs don't have dew claws back there. Some do, but again, it'll be the first long toe in between the first and second of them, up in the middle. Again, these can be sensitive for some patients, so start very light pressure. And then up from liver 3 is bladder 60, kidney 3. That one's actually near the Achilles complex. So if you see the dog's ankle, and then you can see where like the bone comes up and then the Achilles comes up, and there's a thin piece of tissue between those. That's where you can, if you press between the thin tissue, you can feel your finger on the other side. That's bladder 60 on one side, kidney 3 on the other. So you can just kind of pinch both of those, and you can get progress from holding that. And that is actually a really good, they call it the aspirin point because it's so good with pain management. Again, since it's on the bladder and kidney channels, those are really important for kidney function and senior patients. So those are the main overall general pain points. I have other ones labeled here, and they're just correlating to the locations where your dogs might be painful. So for example, if your dog has hip arthritis or hip dysplasia, there are 3 points there around the hip socket. And there's one by the knee, there's a few by the elbow, there's one near the shoulder. I don't expect you, again, to be able to feel anatomy-wise where all the muscle groups are connecting, but if you're just massaging or generally palpating around those areas very lightly, you might be able to find those little depressions. Then there's a line down the back, and that was my version of showing the bladder channel on that side. Again, there's so many points that correlate to different organ systems. So a good general rule is you can just kind of palpate along the spine, again, not on top of the spine, but on either side of it. And there, you can often find little depressions the whole way down. So you can feel some of those. You don't want to do acupressure on each one of them, but if you do feel there's certain ones that have big like depressions, focus on those ones specifically. This one, we talk about hind limb weakness, which obviously a lot of senior pets deal with. I wrote down a lot of the technical names for these, and I'm not trying to overwhelm you with them. My purpose of including the names was that you could take note and Google them if you wanted more specific close-up images of those. But I just wanted to show you overall, a lot of the hind limb weakness points are on the lower back and the hind limb. So the point by way is on the very top of Banjo's spine at the back of his spine. And that's in a depression right on the midline. So if you follow his spine all the way down until you don't feel the spine anymore, it's kind of in the pelvis region where you feel like hip bones and pelvis. There's a little depression once you run your finger all the way down the spine. And that's byway. And that is in charge of the whole rear end of the body, essentially. So it can really help strengthen. Bladder 54 is that point I have right by the hip area. Bladder 40 is basically in the back of the knee. So if you find the crease of the knee where it, it makes an angle like this. So if this is where the kneecap is, you would actually find in the back. You kind of point your finger in and it falls in between a couple muscle groups. So just kind of poking in the back of your dog's knee is a really powerful strengthening point. Stomach 36 is on there below the knee. We already talked about that one. Kidney 1, it was hard to get a good picture of that from here, but it's actually on the underside of the paw. So if you were to pick up the paw, and then dogs have paw pads, and it would be the big paw pad on the bottom, and it's actually, you'd push kind of behind the paw pad. That's really great for hind limb weakness, especially if dogs are dragging their feet. That's really a powerful one. Wei Zhan is the tip of the tail, so you can push on that one. Some dogs are a bit sensitive, but if you can, that's great. And then small intestine 9 is actually the one on the shoulder. So as we talked about, everything is in balance. There's always compensation. And so this shoulder point is actually in charge of the whole front leg. So when we have issues in the back, obviously the front half is going to be overcompensating. So we do want to treat that front as well. Okay, so vomiting and diarrhea. A lot of patients, are dealing with many conditions, so we can help address that with acupressure. The bladder channel up top, bladder 20, 21, and 25, are all in control of the stomach and digestive tract. So again, that bladder channel, get used to palpating along the bladder channel, and you can find those. Those are near, so obviously bladder 23, which was the important one we talked about at the beginning, is in between those last two on his back. So it'll be right in front of that and right behind that, essentially. Stomach 36, we already talked about, really great for any GI issues. Large intestine 10 is a very important one. That is by the elbow. So if you have the elbow, the crease in the elbow, large intestine 10 is actually below the crease. So it's not here. I'm trying to show you. We're not here, but it'll be right below here. And I can feel the indent on my arm right there. Um, so that's a great one. Pericardium 6 is a very famous point. Many of you might know it's kind of the seasickness anti-nausea point. And we find that on ourselves by putting 3 fingers below the crease of our wrist. And it's right there in between some tendons. So same thing on the dog. You see where their wrist creases, and it depends on the size of the dog, obviously, but 1 to 3 fingers typically below that crease. In between, you can feel a couple tendons in there, and it's right in between them. This is all powerful for nausea, vomiting. It also has some heart effects and some anti-anxiety effects. That's one of the greatest ones that you can learn for your patient. Okay, so we're talking about Shangen point, which is for appetite stimulation. So if you have a pet that's having a decreased appetite or not wanting to eat, whatever the cause is, this is one that can provide them some support. I've had some patients do better with this than some of the appetite stimulation medications. So definitely give this a try if you need to. Here's the little Pomeranian Marvin. And so he's got an acupuncture needle on his little nose. You would think they would hate this point, but they actually do really well with it. I've never really had a patient freak out with this point. Obviously, you don't want to come at them like head on. That might freak them out. So I typically do, if they're sitting in front of me, I'll kind of go from behind and do it. But I showed you right here with this sweet Pipple, the location with the green dot. So it's been basically on midline of the face, midline of the nose, right at the junction of where the haired skin meets the non-haired nose skin. So right there on the top of the nose. This is one point where I don't actually recommend you use the palm of your finger. I would actually use your nail, and I would do it for longer. So if you can do it for a minute at a time, that would be great. You can use your nail, you can use like a bobby pin, you could use like the corner of a credit card, just something that's a little bit more pokey than just the palm of your finger to stimulate that. Incontinence can be a tricky one to manage. I've been there too. It's so hard. So these are all bladder points, which makes sense with an incontinence issue. So the bladder channel, again, runs along the spine and then down the back side of the leg. So really, if you just massage that, if you don't want to get too technical, just massage the sides of the spine and then down the back of the leg. That's a good massage way to deal with this channel. But the particular points are bladder 23, which we talked about, which is the one that you follow the last rib up. Bladder 28, which is kind of like right before the end of the spine there. Bladder 39 and 40 are both on the back side of the knee, and those are really great for incontinence. And then bladder 60 we talked about already as well, and that's the one that's like right between the Achilles and the bone. Okay, so there are actually a lot of really great mental points for seizures, cognitive decline. Those can be so tricky to manage, and these can be really supportive. So as you can see from the picture, I know he's kind of turned, he's like curled up in a ball, but this is the top of Banjo's head, and you can see a lot of these points are on the head, and the ear area. So when in doubt, you can always massage the midline from the nose to the behind the ears, and then the base of the ears and the tips. So that's a basic massage technique to address these. If you want to get more specific, again, here are the names. I don't want you to feel overwhelmed by those names, but you can Google them if you need more specific location help. Long way is the one a lot of people know about. It's right between the eyebrows right here. So that's very important to mental health. The now shoe is, I'll try to show you on me. So you have the corner of your eye to your ear. There is a bone right there. And so this point is 2/3 of the way to the ear. And so I don't know if any of you have had headaches, but this is a great one to push. So it can be very helpful with any cognitive issues or seizures. Governing vessel is actually a channel that runs straight down the midline of the whole body. And so these are 3 points located right on the midline of the top of the head. You can find them. Governing vessel 20 is the one in the middle. So there's 3 dots right on top of each other. 20 is in the middle. You can find that by folding the ears over, and where they meet in the middle be GV20. And then the very front line, if you were to draw a line from the front of his ear base to the other side, that's where governing vessel 17 is. And then again, if you were to draw a line from the base of his ears across, in the center of that is 21. So those are all really good points to palpate and apply pressure to. On Shen is one of my favorite points because it's so great for anxiety and any of these cognitive issues. It's at the base of the ears, so you can feel on yourself, the base of your ear, your finger kind of falls into an indentation, and then you can push right there. A lot of dogs respond really well to this if they're scared of fireworks or loud noises. A great place to palpate too. And then the tips of the ears, those are not in the picture, but you can massage those. I don't recommend like holding that. They may not like that, but definitely massaging the tips of the ears can be great. Okay, so that's the end of the acupressure points. I hope this presentation was helpful for you and provided you with some practical tools that you can get started with right away. Again, if you have any questions or want clarification or video or anything, please let me know. I'm happy to help in any way. And again, I just wanted to say thank you to you guys for being such wonderful pet parents and for advocating for your pets. There is so much we can do for these senior patients, and it's just really wonderful to know that you guys are out there wanting to do the best you can for them. I think the quality of life of our pets is something that is the most important of all. And so the more we can do to support that and our time together to make it as full as possible and allow them to do the things they love to do, I mean, that's what it's all about, right? So thank you so, so much. And here is my website, coastalvetrehab.com. I do have a link on there for some resources and recommendations. Some of them are exercise equipment. I do have some books on there that might be helpful. So you can definitely check that out. I am working on some ebooks for different topics. Those are not up there yet, but hopefully soon. And then I am on Instagram. It's at Coastal Vet Rehab. I do share pictures of my patients when they're here. I also try to share some helpful tips and tricks and videos of how I do exercises and how to modify those as well. So I hope that's a good resource for you guys. And again, thank you so much for having me, and I hope you guys have a great day. Give those pets big hugs for me. Take care.